Kami daripada grup 7 akan membentangkan mengenai neutropenia. Saya Azimah, kawan saya Nawa, Karul Bazlina, Nurbaiti dan Umul Nuya. So at the end of this topic, we should be able to define neutropenia and pathophysiology of neutropenia, describe classification of neutropenia, describe epidemiology and demography of neutropenia, discuss risk factor of neutropenia, understand clinical manifestation, discuss diagnostic tests and medical treatment of neutropenia, and create appropriate nursing diagnosis and care plan for patient with neutropenia. So, definition of neutropenia. Neutropenia is defined by decrease in circulating neutrophil in the non-marginal pool, which constitute 4 to 5% of total body neutrophil store. William and Wilkin, 2014. Then neutropenia is not a diagnosis. It is a laboratory finding that signifies that a person may be at risk for infection. Neutropenia is an absolute neutrophil count, which is ACN, of less than 1,500 microliter mm. But before that, we go to component of blood. Our blood consists of 55% of plasma, 1% of white blood cell and platelet, and 44% of red blood cell. So for white blood cell, we consist of 5 types, which is monocyte, eosinophil, basophil, lymphocyte, and neutrophil. So in this topic, we will discuss about neutrophil. Function of neutrophil is to engulf and destroy bacteria and other pathogen. They are the most abundant type of white blood cell in most people bloodstream, which is 40 to 70%, and play a large role in fighting many types of infection. According to C. Summer 2010, neutrophils are produced within hematoponic cords within the venous sinus of the bone marrow, and the number of neutrophils that remain in the circulation can be increased by the addition of adrenaline to the infusion bag. This is pathophysiology of neutropenia. It can cause any of the following, or alone or combination. Sama ada gangguan di bone marrow waktu production, sama ada insufficient or injured in bone marrow stem cell, contohnya bone marrow tumor, fibrosis, drug induced chemodrug, toxin, which is can damage hematopoietic, ataupun dia boleh berlaku di dalam blood, which is shift neutrophil from circulating pool. Contohnya intravascular stimulation of neutrophil cause increased margination along the vascular and decrease the number of circulation neutrophil. Third, in tissue, which is increased destruction of neutrophil in the circulation due to the body's immune targeting neutrophil for destruction. So all this can cause decreased number of neutrophil and can cause neutropenia. Classification of neutropenia got 3 classification: mild neutropenia, moderate, and severe. Mild can define by absolute number of count ACN 1,000 to 1,500. Moderate ACN 500 to 1,000 milliliter. Severe neutropenia ACN count 0 to 500. So the epidemiology and demographic data for neutropenia, the most common form are acquired neutropenia, which is caused by virus, medication, and autoimmune disease. The neonatal neutropenia in the setting of hypoxia, sepsis, and pregnancy-induced hypertension are common. Then the uncommon neutropenia is congenital neutropenia associated with bone marrow disorder.
Okay, proceed to risk factor. So the risk factor divides into 2: decreased production and peripheral disruption. For decreased production, drug-induced alkylating agents, hematologic disease, example idiopathic, tumor invasion, myelofibrosis, nutritional deficiency and infection. And others risk factors is peripheral dysfunction, is anti-neutrophil antibodies, autoimmune disorders, drug acceptance, example aminophylline, vaginous granulomatosis, peripheral pooling, overwhelming bacterial infection, hemodialysis dan cardiopulmonary bypass. So the clinical manifestation such as low-grade fever, sore mouth, adenosphagia, gingival pain and swelling, maksudnya sakit di gusi, skin abscess, ada abscess di kulit, recurrent otitis and sinusitis, maksudnya ada restung ataupun jangkitan di telinga lah, perirectal pain and irritation. So this is example of ulcer kat mulut lah.
Okay, now we go to the diagnostic test. First, line investigation, complete blood count including differentiate leukocyte count and NC. Second, serum electrolytes, urea and creatinine. Blood culture before administration of antibiotics. 2 set of blood cultures from separate vena puncture site. Fourth, chest radiograph in patient with respiratory symptoms and signs. Finally, cultures from any other site as the clinical relevance stool, urine, CSF, skin, respiratory secretion and pus. For the medical treatment for neutropenia, we have antibiotic for fever, antifungal medication to help fight infections, administration of white blood cell growth factors such as recombinant granulocyte colony stimulating factor, GCSF, phlegrism, Neupogen, sagramostism, leucine. Okay, this kind of GSSF is granulocyte macrophage colony stimulating factor, GM-CSF, or phlegrism neulasta, a long-acting form of phlegrism in some cases of severe neutropenia. Another medical treatment, we can do granulocyte transfusion, but it's very uncommon. Finally, corticosteroid therapy or intravenous immune globulin for some cases of immune-mediated neutropenia. And lastly, we can do stem cell transplant, may be useful in treating some types of severe neutropenia. So I pass to my colleague.
So we go to nursing management, which is first we must prevent infection lah, prevent from infection. So patient with neutropenia are risk to get infection then already and will have a decreased ability to be able to fight infection appropriately. Therefore, it's essential to prevent this by avoiding unnecessary lines, drains, tubes. So appropriate care and cleaning and discontinuing lines as soon as they are no longer medically indicated. So second is promote oral care. The mouth is a place that can get infected, which is we eat, we drink, so easily, especially if a patient is on antibiotics, which destroys some of the good bacteria there. It's ideal if someone who is about to endure treatment that may cause neutropenia like chemo can get a dental exam period. Brushing and flossing regularly is essential. So for the third is promote hygiene. Proper hygiene reduces the risk for infection, which is our main concern with neutropenia. So the fourth prevent skin breakdown. So skin is an essential aspect of our body that prevents infection. So therefore, if it is compromised, it can be quite a problem for a patient with neutropenia. Prevent ulcer and breakdowns as they may not be able to heal properly and prevent healing and recovery. So for the fifth, promote nutrition and ensure food is prepared and stored appropriately. Food that is not stored or prepared properly, which causes to infection. So, listeria is a foodborne illness that could be quite detrimental to a neutropenic patient. So, educate on sign and symptom of infection. So, we must teach them, which is patient must know when to alert their healthcare. When if sign and symptom of infection presents or themselves, they can take a treatment quickly. Okay, preventive measurement. Lifestyle precaution for people with neutropenia include is cleaning hands, avoiding crowded and people who are ill, not sharing personal items, bathing and shower daily, cooking meal and eat thoroughly, not buying food in damaged package, so cleaning the fridge, carefully washing any raw fruits, vegetable, avoiding direct contact with pet waste, wearing gloves when gardening, using a soft toothbrush, using an electric shaver rather than a razor. So next.
So I will continue with nursing diagnosis number 1. Risk for septicemia due to low immune system in evidence of increase in body temperature. For the nursing goal, patient will free from septicemia during hospitalization. For nursing intervention, assess patient general conditions such as malaise, fatigue, or pain. Then monitor patient's vital signs to detect any abnormalities in hemodynamic system, including blood pressure, pulse, respiratory rate, temperature, and pain score. Third, explain the risk for developing infection to patient due to his or her disease. Fourth, maintain good hand hygiene. Educate patient to eat healthy diet and provide good nutrition such as neutropenic diet. Advise patient to maintain self-hygiene, such as to shower twice a day if patient capable to do it himself, and teach patient hand hygiene. Number 7, administer prophylactic medication such as antibiotic as per ordered accordingly to time of administration. Number 8, administer vitamin as per ordered by physicians such as vitamin C to boost immune system and fasten healing process. Number 9, monitor blood result such as full blood count, such as increase in white blood cell to detect early signs of infection and efficiency of the medication administered. For the evaluation, patient will free from septicemia during hospitalization. Nursing diagnosis number 2, deficient knowledge on the disease related to lack of exposure of information in evidence by poor self-care. Nursing goal, client will initiate necessary lifestyle changes. For nursing intervention, assess patient knowledge by asking them about risk factor and the effect of the disease to their health. To gain knowledge, to gain information and create appropriate nursing intervention. Number 2, provide appropriate information of the disease such as risk factor, clinical manifestation, treatment, regime on the disease. Number 3, advise necessary of personal hygiene and environmental cleanliness, proper cooking techniques, and food storage. Number 4, discuss need for a good nutritional intake and balanced diet. Good nutrition is necessary for optimal healing, immune system enhancement, and general well-being. Number 5, provide information about drug therapy, interaction, side effect, and importance of compliance with the treatment regimen. Number 6, stress importance of prophylactic immunization and antibiotic therapy as needed. Prophylactic vaccine and antibiotic prevent the occurrence of infection, especially in high-risk groups such as those of extreme age and chronic illness. For the evaluation, client verbalize understanding on the disease and able to take care of himself or herself. This is the reference. So thank you from us.